Thank you. Now, you had a complex sacral fracture after a trauma, and that was 9 months ago. And tell me, you lost some function there. What function did you lose?
I couldn't feel anything below my waist.
Okay, okay. Well, and what about the bladder and bowel function?
Total incontinence.
Yeah, total incontinent. And we looked at your films. You had a very complex sacral fracture that literally cuts off S1 and S2. But on top of that, you had as well some damage to the first and the second disc from below. You got it from the same trauma, from same accident. And the pain, how bad was the pain before the surgery?
That was pretty bad.
Yeah, and we talked about, how to fix your situation. Now, because that trauma was so long ago, I didn't really think that we can gain the function of the S1 and S2 because you have what we call a fractured dislocation of the S1. But I did think we can get the function of L4 and 5 back. And reconstructing the sacrum would have been a very complex surgery, but getting rid of the pressure in the L4 and L5, that would have been a realistic thing. And we did that surgery yesterday almost in an hour. Now, the question is, first of all, the function in the legs. How do you feel today? How are the legs today?
They're pretty good.
Now, let me be very specific. The feeling on top of the foot, which is the L5, how is that on both sides? How does it feel?
It feels more like a foot.
More like what?
A foot.
A foot. So it feels more normal.
Right.
And what about the side of the thigh on both sides? How does that feel?
That feels normal.
That feels normal now. Just and we talked about that I don't expect to get much of the S1 back, the bottom of which is the side of the foot and the heel and so on. How does that feel? Is it still nummy there?
Yeah.
Yeah, and we realistically we couldn't do much for that. But have you walked?
Yeah.
How far did you go?
To the bathroom and back.
Okay, excellent. And if physical therapy clear you, and I hear that they might be able to do that, possibly I can send you even back out of the hospital today. But that's just based on what physical therapy can tell me. Okay.
Okay.
How do you feel though? Do you feel you're ready to leave the hospital?
Yeah.
So excellent. So how bad is the pain right now?
On my lower back right side.
Mm-hmm.
That's where it hurts.
Yeah, well, that we did a big surgery there, so
Yeah.
I'm surprised that it doesn't hurt more. But overall, I think surgery went well. We had about 2 ounces of blood loss, 3 ounces of blood loss, and surgery went really well. Your surgery was barely an hour, and your next day you already probably leave the hospital. Well, I'm very happy, and it seems that you really regained some of the function back. Do you feel that way, or how do you feel?
I don't know yet.
Yeah, obviously, you don't know yet. But you tell me that the top of the foot and the side of the leg feels better.
Yeah.
Okay, well, that is obviously some function back, and the rest of it will be with time, okay? We talked about that we still have to go and finish the job by fixing your sacrum and the pelvis together, but that's going to be for another date. We wanted to stage the surgery so you don't get too much trauma at the same time, okay? Okay, well, thank you so much.